Welcome to A Cup of Joe with Benco. My name is Kay Huff, and I am your Benco host for today. The purpose of A Cup of Joe with Benco is to give you a lot of information in a very small timeline. And today I have Andy Cleveland on the Ninja.
Hey,
Hi, Andy.
how are you doing?
You know what, Andy? I think I probably sent more leads your way just recently for doctors because they're shorthanded in the office and they need help.
Yeah, it's so crazy what's going on right now. Everyone's understaffed. It's just pure chaos every day. So I appreciate you, and obviously we'll do our best to help everyone that we can.
So that's what I called you on for today.
Okay.
If you're struggling, if there are offices out there and doctors out there who don't have enough team members and their accounts receivable, no, they don't necessarily have to be out of hand. You actually will help them.
Right.
What, right, Andy? So I really
Yeah.
want you to give a little description of your services so that a doctor knows they have somewhere that they can reach to. And thinking about the thing about you, Andy, and your services, I know that you are going to take good care of the practice.
Right.
I know you personally, and I know you're going to also take good care of the patients. You're not going to do anything that, the doctor's going to be like, I can't believe that just happened. So if you're looking for some help, I'm going to let Andy give you a little bit of rundown about what he can do to help you out.
I mean, you have a couple issues right now. I mean, number one is past due patient accounts receivable is a big thing, right? Everybody works on the insurance part because that's arguably the most profitable part. That's easiest money to get. Where I see people struggling is just keeping up, sending patients bills, calling them for money. Everybody hates doing it. So you have that collections piece where it's just every month, and you've seen it, Kay, because you're a consultant. I mean, you see it every month. You've got more patient accounts on top of more patient accounts upon more patient accounts. And even with the best intentions, they just pile up. And then next thing you know, you have hundreds of thousands of dollars out. So it always is smart for practices to address this before they have to pull that tooth, right? Where they have multiple years to go back. And then I have to tell them that a lot of it needs to be written off. It's not worth going after. So you've got the seriously past due AR, is the problem. But then the other part of the equation is, how do you optimize your existing team and having them focus on doing things that matter, right? Do you want them calling people for money and confronting with people and kind of being the bad guy and being the annoying one that's like making you, the public kind of look at you like you're chasing your own money? That's kind of aggressive. Just easier to have someone else do it, and then have your staff, have someone else be the scapegoat like us. Have us drive the patients back to your practice and let your staff work the magic. They know these people. They know insurance paid. They know what insurance didn't pay. They knew what happened at your last visit. They can negotiate all these things to get you guys paid and get the patient back in the door. So it's the big picture is efficiency, productivity, leveraging technology, outsourcing, having everyone work together as a team to drive the practice forward. Does that make sense on any 100%. Level, or did I just babble my way through that?
No, 100%. And
okay.
in action. So I know that you will do a good service for the doctors. So doctors, if you are struggling and need some help, please make sure you reach out to Andy Cleveland, the Ninja. Him and his team will be right there to help. Andy, how would someone reach you? I know they can always talk to their friendly Benco representative, but how else could they reach you if they needed to really want to do a one-on-one with you?
Yeah, I mean, it's always great to go through the Benco rep, because the Benco rep really is trying to watch out for their best interests holistically, and I'm understanding of that. But if they need to reach me, they can call my cell. As you know, I just don't have a life. I'm not going to dental conferences right now, so they could call me on my cell, and I'm like, whoa, I got a friend. Someone's calling me. This is exciting. And then it's just another telemarketer wanting to extend my car warranty. But my cell phone number is 864-517-2233. Even if you want to talk about the weather, I'm happy to do that. You'll get treated well.
Well, listen, Andy, thank you so much for again joining me on A Cup of Joe and Benco today. And please make sure if you need some help, reach out to Andy. He'll take really good care of your patients. So thanks, Andy.
I appreciate all that you do, and thanks, Kay, for everything, and keep hitting the road. I see you out there, so you're doing some great things out there, so keep up the good work.
Thank you, Andy. Bye-bye.
Right. Thanks. Bye.